orthopedic Majin. We're here with one of our patients who traveled to here from Texas, correct?
No, Auburn, Alabama.
Sorry, Alabama. All right, so Alabama. And why did you come to Deuk Spine Institute?
Because the last flare-up of L4 that ruptured in 1999 was unbearable, and my wife can be a testament to that, who took care of me for 10 days, crying on the floor with an amazing, incredible pain.
Okay. And you've had that pain now in your lower back for 22 years?
Yes.
You've tried physical therapy and exercises, stretching, but none of those things worked?
No, temporarily.
Yeah. And where was your pain coming from? Do you know?
It was around the belt region in the back, yeah.
So the L4-5 and L5-S1 discs had tears and they had inflammation and pain. He also had sacroiliac joint inflammation and pain. And Dr. Patel standing here, which we don't get to see you very often, but Dr. Patel was a hero. He came in and did the bilateral SI joint injection.
Yep.
So do you still have the pain in your back that you came here with?
No.
It's gone.
It's very, very gone, yes.
Excellent. Well, it should stay gone. Is there anything you want to say to your audience?
Well, I think more people should come and start looking at this procedure, finding the website, learning about what are the things that needs to be done, such as sending the MRI, and trust on the incredible treatment and experience that I have received from this team. It's relatively impressive, very impressive. And I would recommend it to many of my friends who play golf and has been suffering for a long time.
All right, very good. Well, have a safe trip home.
Thank you, sir.
So finally, this is 1 hour after my procedure, and I am walking just fine. I'm gonna turn, very stiff, and then I'm gonna walk around, and so far so good.
I feel very, very pleased. 24 hours after the procedure was performed on me on L4, L5, and S1, the L4 injury has been there for 21 years and has never give up and has made my life miserable. And the initial injury occurred because I have congenital issues inherited from my father, who suffered tremendous sciatic pains, and all my five brothers also have the same issues. So this is only 24 hours after. I already walked a mile this morning, and I only have taken 1/3 of the indicated medications, and I still have no pain, with considerable improvement over 3 or 4 major landmarks. The first one is pain down the leg, the right leg, where the main injury occurred, as well as pain on the left and the middle of the back for the 2 main new discs that were also injured, the L5 and the S1. So I recommend this procedure to anyone who, like me, has suffered for many years and were afraid to the pain that is inflicted with some other technologies that basically requires months for rehab. And I will not hesitate to submit myself to another procedure if it's needed, Dr. Deuk's Spine Institute. So I thank everybody for all the service, outstanding service, medical and social.